Dr Nick Coatsworth was the Federal Deputy Chief Medical Officer at the time, guiding us through uncharted territory and COVID vaccinations.
When people cannot do their jobs and are threatened with termination and indeed terminated from their employment because they don't get vaccinated, that is forcing. And unfortunately in COVID, there was emerging evidence but during the mandates for vaccines that the vaccines did not stop transmission and that indeed young men in particular were subject to a side effect from mRNA vaccines, which was inflammation of the heart. And so as soon as we knew those two things, the mandates effectively became unethical and we should have abandoned them straight away. Indeed, young men in particular were subject to a side effect from mRNA vaccines, which was inflammation of the heart.
The member for Hughes. Thank you, Deputy Speaker. Yesterday, I wrote to the head of the TGA, Professor John Skerritt, and called for, based upon the latest deaths data out of the UK, that there should be an immediate suspension of the COVID vaccinations on Australian teenage males. That data shows that for the first 41 weeks of 2020 in England, last year, 2020, there were 347 deaths in the 15 to 19-year-old age group. However, this year, in the first 41 weeks, there were 450 deaths. That's an increase of 103 extra deaths this year in males aged 15 to 19 in the UK. And what is greatly concerning about that data is that for the first 16 weeks, there was no trend. The deaths in 2020 matched the deaths in 2021. They were on par. But since week 16 in the UK, we have seen an over 50% increase in deaths in young males in the 15 to 19-year-old age group. Now, what is the great concern is that that coincides exactly with the timing of the rollout of the COVID vaccines in that age group in the UK. And what is also of great concern is that we are not seeing this same increase in deaths in young females in that age group in the UK. And we know from the US data that the incidence of myocarditis and pericarditis and heart inflammation from the vaccines is heavily and overwhelmingly weighted to young boys, to males. That is exactly the data that we are seeing in the UK. If we are to apply the precautionary principle, and there may very well be other explanations for this dramatic surge in deaths in 15 to 19-year-old males in the UK, there could be many explanations. But given the coincidences and the correlation that the deaths are overwhelmingly weighted to males and not females, and giving the correlation of the increase coincides exactly with the ramp up of the vaccines in that age group. If we are to apply the precautionary principle, we should suspend these injections in all young teenage males in Australia until an alternate explanation can be found.
Vaccines did not stop transmission and that indeed young men in particular were subject to a side effect from mRNA vaccines, which was inflammation of the heart.
There may very well be an alternate explanation, but our history and tradition tells us that we must apply the precautionary principle, especially when it comes to teenagers, 15 to 19-year-olds, that have 6 or 7 decades of life ahead of them.
Don't you need to pull your head in?